Hi, Dr. Harris. Thank you again for taking the time to be here. So we're the urban entrepreneurship team that'll be partnering with Harris Family Health. So just a quick introduction for all of us. My name is Cameron. I'm currently a chemical engineering major. I'm a senior. So I know you mentioned last week when you or that you're a chemi too. So I kind of thought that was cool, just coincidence. But anyway, yeah, I'm a senior and I'm really looking forward to hopefully helping you this semester. And I'm in some other organizations that have to do with like community outreach and stuff like that. So it's definitely one of my passions as well. So I'm looking forward to this interview and going forward.
Nice to meet you.
My name's Jack. I'm a mechanical engineering student, a senior. I guess I chose this project because this summer I'm going to do an internship with medical devices at a company called Stryker. Um, and I guess just learning how the healthcare system works seems to be valuable, maybe for that in indirect ways. So I figured this was a good opportunity for me as well. Nice to meet you.
Yep, nice.
Hi, I'm Min. I'm an econ major. I'm a senior graduating this semester, and I chose to work with Harris Family Health this semester because I found your whole business model very interesting. I've never really heard of the subscription-based healthcare model, and I think that it can provide people with better service, and I hope to learn more and provide whatever value I can. Nice to meet you.
Nice.
Hi, my name is Jamia. I'm also an econ major. The reason why I chose this project was mainly because I grew up in a situation where individuals struggled to have health care. So I feel like I loved you guys' business model, and I feel like something like this would have definitely helped when I was growing up.
No, definitely understand that. Well, nice to meet you all.
Do you mind just quickly kind of introducing Harris Family Health, how long you've been doing it, kind of just background?
Yeah, no problem. Dr. Harris, I'm a family doctor here in Flint. I came back home in 2020 after finishing residency, which is the training you do after medical school. Worked for a couple years, but then decided to go out on my own and start my own medical clinic to be able to provide quality care and more personalized care to my patients. Originally didn't think I was going to do a membership based. I was going to do a classic clinic, but decided that a membership based clinic fit right with kind of my vision and my passions. And so I started Harris Family Health in January 2023 as Flint's first direct primary care clinic and membership based clinic here in Flint. I see adults and children. Everyone pays a monthly membership fee, no matter their insurance status. If people have insurance, they use it for outside services. But if their insurance has like a high copay or deductible, or they don't have insurance, then I have discounted ways to provide medical care to patients.
Can you go into a little bit more detail about the community that you're in specifically? So in Flint, when it comes to the problem that you're addressing, kind of what was your motivation for trying to solve that problem and kind of what is the healthcare system in Flint currently look like?
Yeah, so I mean, a lot of cities in Flint, a lot of cities in Michigan are automotive kind of based historically. Flint's one of the larger cities in Michigan. We do have, I don't know what the median income is, but it's like 30 or 40,000. And most of our patients, as far as health wise, are on Medicaid. The difference is as far as insurances, people have insurance through their employer. And they have insurance through the government. As far as Medicaid and Medicare, Medicare is the over 65 plus individuals. After Obamacare, people were able to buy insurance for themselves and just get primary care services, specialty services, whatever it may be. But in Flint, most people do have insurance. Probably, I haven't looked in a while, but at least 95% of people have insurance in the different kind of capacities. And so my clinic isn't necessarily for those who just don't have insurance, even though that is enough. If everyone who didn't have insurance came to my clinic, I would be over capacity. But my clinic was created as an option for people who either in the current health system weren't getting the quality care they wanted, whether that's time with their doctor or things kind of worked up appropriately as far as just being comprehensive and thorough. But on the other end, the health system is very expensive,
Hmm.
very it's gotten very greedy over the years, and so there's a lot of hidden costs to accessing care. A lot of people don't know that to have insurance, you pay a premium, which is the monthly charge. But to use your insurance, you potentially have to pay a deductible, which is thousands of dollars depending on the insurance and the number of people who are on that insurance plan. And so I just wanted to simplify everything. As a primary care doctor, my part of the healthcare is not the expensive part,
Mhm.
though everyone who accesses the healthcare system needs a primary care provider in order to work up things, refer them to surgeries, carry them when they get out of the hospital, whatever it may be. And so my approach was trying to provide quality and personal care to everyone, but kind of taking the blinders off when it comes to how expensive healthcare is and how affordable and accessible it can be through a more streamlined approach.
Right.
And so I just took out the complicating parts of, will the insurance cover this? Will they not cover this? How fast can I get into the doctor, how long we'll be able to spend with the doctor. All these things are very frustrating for people. And so the things that people were negatively saying about their experience with the health system, I was trying to combat that with a opposite effect, as far as spending more time on patients, letting them have longer appointments, not being behind a bunch of barriers when it comes to communicating with the doctor for simple stuff or complex stuff. It just, if you call a doctor's office, there's a lot of in between people. But also just having that classic or old school relationship with my patients.
Right.
When you talk to your parents or grandparents, they probably are very clear about how the health system has changed over the years, how they're, the doctor that they used to have when they were younger, they had a better relationship with because they had them for years on years on years. And they knew them because they were, based in the community or whatever. But that has changed as our health system has become more um, merging, more kind of all-purpose facilities with a lot of people that you aren't necessarily knowing kind of people by face and stuff. And so instead of making things complex and making things confusing, I just really want to make it a very simple process. And for me as a doctor, being able to spend more time with my patients and actually just focus on medical care versus all the like documentation and paperwork and um, regulations and all these things that they have us do in the background, that's not necessarily just focused on patient care. So
Right.
for me, it's a personal decision to have more patient care and not all this other stuff. For patients, I think they just have a lot better experience and feel like they're actually getting healthier because someone's taking care of them more.
Right. How did your passions for building relationships with patients and stuff like that kind of manifest into the business itself, if that makes sense?
Yeah, so when I started my business, the business is what was like the new piece.
Hmm.
Um, my style of providing care for patients has always been very comprehensive and thorough. It just, when you're trying to be a good doctor to everyone, it gets your personal life gets taken down as far as the time that you have for kind of other things. And so I've always been someone who connected with my patients, even if it was a 10-minute appointment. Um, I try to, follow up with people in my own kind of side time just to make sure that they were taken care of. Flint has a lot of disparities, whether you look at education, you look at health, you look at working, income stuff, whatever, like we're kind of on the bottom of a lot of lists.
Hmm.
And so I didn't want my patients when I moved back home, I didn't want my patients to feel like they weren't getting the care they deserved. And so that part of my style of practicing hasn't really changed. I have more time now. And so instead of, trying to crunch things into like a 10-minute, 15-minute type of situation, I can stretch it to a 30-minute, 60-minute kind of thing. And just by default, you get more information and more things to address in that setting. But my medical care and medical style hasn't necessarily changed from my clinic. It just gives me a better platform to do it without having as much stress. Uh,
Awesome. What for you has been the most rewarding part of having your own business?
oh, that's a good question.
Yeah.
Time. When I was in like high school and stuff, I was involved in a lot of things, which a lot of Michigan students are. So I wasn't different from that aspect. But from undergrad to medical school to residency, I didn't actually have control of any of my time.
Hmm.
Because you're training, you're educating, you're learning stuff, all this jazz. And then when I finished all my training and got my first job, I still didn't have control of my time. I was working 40 plus hours. Well, I was never working just 40 hours. It was at least 60 hours a week, just
Hmm.
trying to like catch up on things. And so now having my own business, I control my time. I am open, when I want to. When I don't have a patient in the morning, I don't have to necessarily come to the office. I'm closed on Fridays. I'm able to just have more flexibility. Like same day appointments are a lot more easier because I'm able to squeeze people in because I'm like, well, I do have like yesterday, a patient, a new patient was like, oh, I have an appointment on like the 19th or something because I'm going out of town next week. So like all my schedule is kind of blocked next week. And she's like, can I get in earlier? And because I had some changes in my schedule, I'm like, yeah, if you can come at this time. But like previously, I didn't have that type of flexibility. And so having time to do the things I want to do clinically, but also having the time to do other like non-clinical things. I'm like I told you guys before, like I'm involved in a little outreach stuff. Like the stuff you can see in the background is like a thing I have next week doing CPR. Like I can do all these other things that I didn't think I had the time for previously because I was so stressed and busy with my primary job. So time is the big thing when you own your business. The problem is now I don't have as good of boundaries because it is
Mm.
my business and it could be 7, 8 o'clock at night. I'm like, okay, let me see if I can figure that out right now instead of like doing it during a regular kind of like first shift type of stuff. So, but having control of my time is the biggest thing.
Awesome. Well, thank you for all that information. I think now we're going to transition into more of the business aspects of things, and Min will be taking over from here. But thank you again.
Yeah, so just starting off the section is, how would you describe as being your primary customer segments that your business serves? Say just 1 to 3 different customer segments that you would say are the main demographics or groups of people that your business serves.
I would say my three main kind of sectors: adults 30 to 50 are probably often that's like my main group right now. Black women specifically is another group, and I feel like those are like my main two. But I'll also say like I'm getting more uninsured people now, technically, as they've kind of learned about me, which is kind of cool because like I'm not necessarily always advertising to those who don't have insurance.
Mhm.
But if you don't have insurance, my clinic can give you a lot of primary care needs that you previously thought were unattainable. So I would say those are probably the three.
Got it. Thank you. And as an add-on to that, can you think of any customer segments that you aren't currently serving, but you think would be a good fit for the business that, in the near future you would like to be able to interact, engage with?
Yeah, my main one that I'm hopefully this year kind of can get more into is employer contracts. And so by law, companies that have over 50 people have to have a formal insurance. But those small businesses that don't have 50 people, they might just say, we don't offer those benefits, which in Flint or in Genesee County, over 80% of our small businesses don't have any health benefits. And so that's a space that I really want to eventually get more into um, because for small businesses to have a formal insurance, it's very expensive. It's thousands and thousands of dollars, whether they use it or not. And then it's more if they use the insurance. And so that's a space that I want to get more into because I can offer a primary care package to people. It's the same package that all my other individual patients have, but
Mhm.
if an employer sponsors someone's direct primary care membership, that makes them a little bit more competitive as far as offering that health benefit. But it also helps them, keep their employees healthy and keep them kind
Right.
of happy and stuff like that. So, small businesses is something I want to get more into, as far as at least offering their primary care coverage. That is what most people need in a general sense, anyway.
Right. So outside of that, what do you think are the other key benefits that your business provides to your main customer segments?
I think the convenience of quality care is probably the biggest thing. Because I'm not saying I'm like the best doctor. Like I'm a good doctor, just like many other doctors around here. But when you work a job, it's very hard to get off for
Mhm.
um for medical appointments or this and that. And my patients knowing that when they have an appointment at 10 o'clock, it's definitely going to start at 10 o'clock and you're definitely going to be out by whatever time that you planned on being out versus having to go somewhere, wait a long time, barely see your doctor, and you end up spending 3, 4 hours at the doctor's appointment. And so
Right.
that convenience right there helps a lot of my patients actually advocate for themselves and prioritize their health. And the addition of like being able to text me, being able to email me, knowing that they're not going to have to, run around trying to figure out how to get in contact with their doctor. But I think that is a big piece. And then for those who do need the cost saving stuff, being able to provide kind of in-house medications or discounted like blood work and stuff is very beneficial for those who are trying to save money. Because I have patients who have insurance who, when they told me the cost of their medicines, they asked if I could order it, and I was able to save them $80 on their medicine just
Wow.
because I ordered it just like the pharmacy orders it. So there's that piece, and it's all case by case. But convenience and cost savings are probably the biggest things outside of just trying to be a good doctor to my patients.
Got it. Thank you. And the next question that we have is, how does your customer, purchase or acquire your service?
Yeah, so there's two ways that people kind of initiate. Either they call me and they say they're interested and I take their information as far as their name and their email address, or they go on my website and click the enrollment button and again fill out their name and their email address and stuff like that. Once I have their information, I create a personalized member agreement for them to sign through their email. Attach that agreement to a standard invitation email and send that to the patient or the potential patient. They have the opportunity to review it electronically. Most of them review it electronically. Some of my older patients, it just didn't work out, and so they just come in and sign the paperwork.
Mm.
But most people electronically review it, electronically sign it. In that first agreement, it also has their payment information. And so once they sign it, I process the payment and then send them an email of making a new patient appointment as well as their actual like health history intake form.
Got
And
it.
once that happens, they just make an appointment and we kind of go from there.
Okay, thank you. And then the follow-up to that is, how does Harris Family Health acquire new customers?
Yeah, there's probably a few different ways. I have social media, I have an online presence. A lot of medical clinics don't actually have a broad online presence,
Mhm.
which the internet's been around long enough for every clinic to have their own website, but that's a different conversation.
Yeah,
So I have an online presence. So when people search for Dr. Near Me or look at Google Maps or whatever, I pop up as an option. If people follow me on social media, they just generally obviously see it because they're following me. I'm also just involved in different just community events and stuff. There aren't a lot of people, a lot of doctors in our area who do like a lot of health education. And so I've kind of gotten to that space well, probably because I'm a primary care doctor, so I can talk about a lot of things. But I've
right.
gotten to that space as like a short list where people are like, "Oh, wait, Dr. Harris might be able to talk about, so and so." And so then people see me in those spaces, and um, I always intro with kind of who I am and where I work and what I do, and then kind of go into the health topic. Um, I'm involved in like our business chamber, commerce chamber, chamber of commerce. I forgot what it's called, but it's basically like a group of businesses across the county. And so I just meet people in that space. I told you guys before, I got like the billboard. I've gotten
Mm.
a commercial. Um, so those are probably like bigger things, but I actually haven't gotten anybody from those specific things. So I won't be actually paying for any of those in the future. They're expensive. Um, I write for one of our local newspapers. So on a monthly basis or twice a month, people kind of see an article from a doctor in this newspaper. And so they read the article, learn some things, but also kind of at the bottom can see like who I am and where I'm from.
Mhm.
Um, but I think at this point, a chunk of my patients are coming just from word of mouth. I built up enough um, people that they've mentioned like, oh, you got to go see my doc. Some of my patients are really really excited about me and what's happening, and so they say it a lot even when I'm like out and about, because I can't tell people that I'm their doctor in the public, but
I see.
it's really cool when my patients kind of say like, oh yeah, that's my doctor. And so their excitement kind of definitely brings some people in, and some of it is just me just helping people and them figuring out like, oh, like who helped you, made you feel better, and they're like, oh, Dr. Harrison, stuff like that. So word of mouth is probably the most recent thing that's kind of building more momentum, which took time because I had to get enough patients who then felt like they were getting good care and want to kind of say things. So different ways, but all kind of hopefully kind of going toward the same goal. As a small business, it's hard to like pay for marketing and stuff, so
Right.
I have to be um, very specific about how I spend my funds and stuff.
Hmm. So you'd say you've definitely been able to leverage your like presence in the community to, advocate for your business and spread awareness for it.
Yeah, I think that's what's happening more recently because a lot of the digital stuff or printed stuff hasn't really changed over the last year. It's been like this, I've been doing them, but my involvement in the community has been slowly increasing over the last year.
Mhm.
And with that, people kind of are knowing who I am, where I'm coming from, and like are just getting a little more curious with what's happening.
Yeah.
And uniquely, most of the doctors who work in Flint don't live in Flint. So me just like living my life also is helpful because people are like, oh, you're Dr. So and so. And I mean, I don't recognize them, but they recognize
Mhm.
me, which is cool. And I think part of that is the fact that people want to know who they're about to go and say all this
Yeah.
personal information to. And the health system classically doesn't really allow you to just like meet and greet your doctor and stuff like that. And so you have to actually go through the process of waiting for a new patient appointment, which may take some months. And then you got to get there. And then depending on how it is, you may or may not be feeling that doctor. And then you may not actually kind of go back, or you may go back. You may really like them. But with me being involved in the community, people can understand my personality, my style. Me doing health education stuff is not much different than me doing health education to my patients. And so I think that helps kind of people know what they might get if they actually do become my patient. But yeah, being present is been, I mean, I'm like I said, I'm just living my life, but being present has been really awesome for um, people to ask questions,
Mhm.
people ask questions about my membership or just ask kind of health related questions. Because my ultimate goal is for the communities to be healthier, whether
Right.
they're actually my patient or not.
Hmm. Yeah. Our next question is, would you say that your business has any key partners or suppliers? And if so, what do they provide?
I wouldn't really call them like key partners because most of my business is me and my medical license and like my medical knowledge. But I mean, I do have people who supply my medications, and so that's collaboration. I do have um, an agreement with a local lab company to supply my discounted blood work and things. Um, but those are probably the only like true connections I have with other health
Mhm.
suppliers or health services. Because everything else is kind of me providing whatever skills and knowledge I have for the patient. But
Mhm.
those are probably the formal things. I mean, I have collaborations with local people as far as just like the outreach piece, but
Right.
clinically, those are probably the only two that I actually have agreements and partnerships with.
Got it. Thank you. And what, if any, would you say, what are the key resources that your company possesses? So anything from land, buildings, money, equipment, people, intellectual property.
Uh, I'm my main resource. The building that I'm in, I'm renting, which I hope to have my own building in the future. Uh, I mean, I have medical equipment as far as the exam table and like my stethoscope and things like that. But even those are not that expensive.
And what would you say like the biggest expenses in your business are?
My top expenses are my rent and my malpractice insurance. Um, Probably the combination of those is at least maybe half of my monthly costs.
Mhm.
So yeah, those are my big ones.
How much money does the business like, or can it make within like a typical year of operation?
A typical year, that's hard to say because I'm still growing. Um,
Right.
but if I got to 100 patients, that's $8,000 a month. Um, so my expenses are about $2,000 a month.
Okay.
Yeah, if I got to 100, that yeah, that's $8,000 a month, 8 times 12, 80, 16, 96,000.
Mhm.
Um, so that would be the revenue of that point. There are some people in my position who make $500,000 or $1 million, depending on how much they charge their membership. It all depends on the membership stuff.
Right.
Because my expenses on a monthly basis don't really change that much unless I'm doing like I all of a sudden buy some equipment or
Right.
do something random. But my month to month expenses don't actually shift that much.
Hmm. So in
Um,
terms of like a strategy for growing or like the kind of scale that you want to reach, what would you say like is 100 patients like your kind of end goal? Is that, somewhere along the way of what you want to reach? And do you have any plans of like expanding the business through, let's say, more doctors coming in and joining you or?
yeah, so my first goal is 200 to 300 people.
Okay.
Um, I don't know what I'm going to do beyond that point, purely because if I go beyond 200 to 300 people, I have to decide how many, like what my staff, like I'll have to probably
Right.
bring, like right now I'm a company of one.
Hmm.
Um, and so if I wanted to do 400, 500, 600 people, I would have to have like a nurse and front desk people. Like it would just have to be a bigger kind of expansion plan.
Hmm.
And so my initial goal right now is the 200, 300, and just kind of readjusting once that kind of happens.
Right.
Um, my goal as far as expansion, I talked about having my own clinic eventually. And
Hmm.
once that happens, then my vision of my clinic will probably change. Right now, I'm in a 3 room kind of suite. And so I know I'm limited on what I can do here just because of capacity and space. But once I do have my own clinic, then having other contract workers as far as a massage therapist, a dietitian, a behavioral health therapist, like having all these other people who can provide their own individual services to my patients and others will be part of the plan as far as a medical kind of campus medical center. I don't plan on like formally bringing on other doctors. I think that I'll be an asset as far as like a mentor, showing them what they can do and how to like start their own membership based clinic.
Hmm.
And maybe in that setting, them renting out some space in my clinic and my software and things like that, but them themselves being their own kind of entity.
I
Um,
see.
and
And that goes for the specialists too, like the dietitian and the massage therapist.
yeah, because
Okay.
when I first started, I thought I wanted to have like multiple employees and stuff like that. Because I don't know a lot about that space, I'm a little bit uh I won't say concerned, but like reserved in the aspect of like bringing on more people and like the tax stuff and the benefit stuff and you got to like well, it's a safe space, but you got to be safer when you have other employees of like
Right.
other rules and stuff.
Right.
And so my idea of expanding is kind of contractors where they're their own thing, they have their own liability stuff, their own insurance stuff, they have their own like services because I also don't want to bring on more people that I have to like supervise too much.
Right.
Basically. Um, so yeah, so we'll see what it is in the end, but I really do hope that other membership based clinics kind of come into the Flint area because it is beneficial to offer people an alternative.
Right.
Um, some of the people who are doing what I'm doing do have multiple clinics. They have little satellite spots and are creating kind of a system in its own. Uh, that's not really my vision. And I think part of that is because I'm finding that I'm less clinical than I thought I was going to be in the sense that I like doing outreach. I like doing policy stuff. I like doing community stuff. So like if I make my clinical too big, then I won't be able to do that other stuff that I enjoy.
Right.
So
Hmm.
that's my balance.
What technologies would you say the business uses?
Yeah, all of my clinic is mostly paperless. And so I have a software for like documentation. I have a software for prescribing medications. I have a software for scheduling, for document signing, mm, for graphic design stuff. Yeah, I pretty much have a software for most things to help me organize stuff, but also just keeping things as kind of simple as possible.
What like special capabilities do you think that Harris Family Health has that sets you apart from the rest of the competition that you face?
I think from a clinical clinical standpoint, I think the personalized care that I can provide is very important. I think people are they get easily frustrated with the system of not being able to like feel heard and get the quality care that they want. And so I think that's a big aspect. The convenience of the communication options that I provide is unique because most people, if you call their doctor's office, you're not gonna get their doctor immediately. You're gonna have to go through some people, or um, they have patient portals where you could like message a doctor, but even those are not necessarily purely answered by the doctor. They could be, a nurse or someone else kind of staffing. So I think the communication options is very, very nice. I mean, the fact that I'm accepting new patients is probably a chunk. A lot of people around here are not accepting new patients, which
I
is a
see.
frustration that a lot of people have. Um, I can actually consistently do same day appointments, unlike some of my counterparts who that's why people go into urgent cares because they actually can't get in, or go into emergency rooms because they can't get in. Um, Outside of clinical stuff, I'm able to like, I won't say read the community, but like navigate some of their needs a little bit more uniquely, which is kind of how my massage therapy package kind of came about as like an option for my patients, but also an option for the general public to come to my clinic a couple times a month and get massages from another contract situation with a small business massage company. Uh,
Hmm.
but also, I'm able to move differently in the sense that if my patients needed a home visit, I can actually do that with a lot of ease. I mean, obviously, I don't have all the same equipment in my bag that I would have in my clinic, but there's some flexibility and fluidity to that. Um, a lot of doctors can visit their patients in the hospital, and so that's not really unique. But um, the connection that I have with my patients when they are at their kind of greatest need is, I think, a really awesome thing. As the years go on and I know my patients better, then those connections will become even stronger as far as being able to know what's going on and help them navigate what's happening. Um, I also feel like it hasn't really happened yet, but if there was some kind of medical need, medical gap that needed to be filled that I'm able to do as just like a primary care doctor, I can do it with a little bit more ease as far as like if I feel like it's a good idea that I can implement it versus other clinics that have to go through a lot more people.
Hmm.
Granted, I'm strapped as far as like if there's some financial component to it, but if it's a skills based, time based thing, then I could definitely feel some emergency need that might be present in the community.
Got it. Thank you. And now I'm going to pass it on to Jack to finish the last portion of questions for you. Thank you.
The next section is going to focus on competition and market forces. So I guess the first thing I want to ask is, does this type of primary care subscription-based model exist anywhere? And if it does it exist in Michigan at all?
Yes, yes. It exists throughout the country. Actually, it exists more in international spaces too, because they are not as structured as we are. But yeah, it exists across the country. The first one in Michigan um, was, I don't know what the first one, but one of the first ones was Plum Health in Detroit. There are a lot more in the like Ann Arbor, Detroit suburbs, Detroit area. But there's still some up in the UP and Traverse City and things like that. And so there are multiples in the Michigan area, and in other countries too, or other states too.
Yeah. Okay. So I guess within the Flint area, would you say your main competition is just like other primary doctors, like the typical primary doctor you'd see type of thing?
Yeah, probably the largest is just regular primary care offices. When it comes to those who are like uninsured, we have these fairly qualified health centers here that are able to fill that gap, as well as a free medical clinic. Um, but those are not as plentiful as just like a regular primary care office. And so purely from just primary care needs, there's a lot of competition. Like there's a lot of people who are taking care of patients as far as primary care needs. But when you start taking it down to like some of the unique things of my clinic, as far as being able to provide the discounts and access to like wholesale things, I'm able to do that for those who aren't able to afford stuff, and that's where the free clinic, we only have one, and then, like I said, the federally qualified health centers, they take everyone, insured or uninsured, because they
Hmm.
have grants to do that. So.
Ah, okay. Okay. Um, so I guess when we're gonna shift to kind of building the business here, what challenges, I think you said you started a year ago. What challenges or like hurdles did you have to overcome when you were first building your business to get off the floor?
Um, I mean, my biggest hurdle is just getting people to know what I'm doing and what type of kind of opportunity it is for them as far as their care. And that's kind of a continuous thing because I am the first membership-based clinic here in Flint. Yeah, so it actually didn't cost me that much to start my clinic. It was like $5,000 or $6,000. And that was kind of the security deposit, my license renewal. I left my job before they paid for my license. I should have stayed a little bit longer.
Oh yeah.
Um, but I had saved that money personally just from when I decided that I was going to start my own clinic. I started trying to be a little bit tighter with my funds. And the beauty of the membership-based clinic is I don't need as much funds as some other medical clinic that was taking insurance and needed more kind of space and capacity and staff and stuff. And so I didn't get like a business loan or anything. It was all from my personal savings that I started the clinic. I got kind of equipment and stuff from like Facebook Marketplace and like eBay, and some stuff I bought kind of fresh, new. But because a lot of medicine is electronic, outside of the exam table, everything else is kind of like interchangeable with other kind of office supplies. And so I just had to figure out what I wanted in my office and what I needed at that time. Some stuff is aesthetic, like I don't really need that plant, but like I wanted a plant in my office type of thing. But the exam table was kind of like the thing I definitely needed, and the stethoscope and stuff to take vitals. Everything else was kind of optional because I don't write down that much stuff. Everything's kind of electronic, so I just use kind of my computer.
Um, okay. I guess the next question is, I guess what's the biggest strength of your business and what's the biggest weakness of your business?
Um, I feel like they kind of go together. Uh, I think the ease that people can become members, become my patient, and be seen is really an awesome kind of asset. Because I mentioned before that it sometimes takes a long time to be a new patient somewhere. And the idea that they can be seen pretty quickly and get the care they need, medications, blood work, whatever it may be, I think is really awesome. And people are really surprised how kind of quick they can get in and the care that they will get from just that first kind of encounter. On the counter of that, because I made it so easy, people can also leave easily. And so on a month-to-month basis, I'm not quite sure how many people are going to want to stay as my members and my patients. And so there's some like a little bit of stress at the beginning of the month. Well, I guess most of our money comes in the beginning of the month. Some of it comes in the middle of the month, but there's a little bit of stress when there's membership dues or membership fees kind of coming in or not coming in, and what that looks like for maintaining my business and kind of the expenses and stuff. And so that's probably the thing that's probably most frustrating. I think is kind of a weakness of the membership based model because I'm not like requiring people to stay. I'm not, pulling them by their hair trying to say like pay me the money and stuff like that. It's not like a threat situation, but because they're able to come in so easily and come out so easily, then that kind of makes the stability of the business a little bit unknown sometimes because who knows, like people, I have people right now, but maybe every one of my patients in March decide like, ah, I don't want to do this. Then that's my whole that's my whole business.
Yeah,
Um,
right.
yeah, so I think that's the weakness of it all is that it's not none of it is guaranteed. But it is easy to grow and easy to kind of bring in funds because every single patient is a new funding opportunity.
There any like sort of other revenue streams that you envision yourself collecting eventually?
My main one is the memberships. Eventually, like the massage therapy package and thing, like
Hmm.
that person's technically paying like a rent to use the space and stuff. And so those are side opportunities that I'll have with my clinic, especially once I expand to a bigger space, but majority of my revenue is purely off of the membership fees. I have some, I wouldn't even call it really revenue. It's kind of more break even when people like uh, get my in-house medications. Like I charge them the bottles and stuff like that, but I'm not actually making that much money off of the in-house pharmacy. I'm not really making money off of the discounts for blood work. Like I charge them the draw fee, um, just as like well, because I don't want to take on that draw fee, but those two pieces are the additional charges that I do to my patients miscellaneously, but they're inconsistent and like I said, it's pretty much mostly a break even. And so yeah, my membership fees are 99.9% of my revenue right now.
Yeah, right, right. So with, I know you kind of said a challenge is, not necessarily a challenge, but a concern is that some customers might leave month to month. Is there any type of solution that you can like think of to maintain customers longer term?
I mean, the biggest thing is trying to provide value and patients seeing that value of having a safety net, even if they're not seeing me on a month to month basis, and kind of how they are trying to prioritize their health and how I can be a resource. There are ways to be a little bit more tight on like the agreement and terms and the legality of like terminating something before you're like you sign that you would. But I had opted kind of like not to chase people, not to try and force someone into something that they didn't want to, because that's not really a healthy doctor patient relationship. Um, I know there are ways to mitigate the idea of someone leaving. And so eventually I will have like an enrollment fee. And so it will kind of cover kind of like a security deposit when you move into a place. Like if you leave early, then at least this enrollment fee will subsidize the fact that like I lost money because you left earlier than planned. Um, but yeah, so there are ways, but it really just depends on how much you want to work to get people to stay. Um, but my thing is, if someone wants to go, I'm not gonna force them to stay. But my goal is to add as much value, whether they're seeing me all the time, all like on a monthly basis or not, so that way they feel like the funds they're contributing to their membership are going to a good cause. Because in reality, my appointments, not my appointments, my membership in a whole year basis is equivalent to 2, 3 appointments in the world, not in the world, but like in primary care. And so when you don't
Mm,
actually pay for your appointments, you don't realize that seeing me is a few $100s an appointment. You're not paying that in the like this one setting. I've kind of spread it out over, a month to month, year kind of sum, but that is kind of how much it costs to see a doctor. But people don't really know that piece of it.
right. Yeah. Um, okay, so I think I'm done for my section. I'll open it up to the rest of us if there's any other questions you want to ask. If not, feel free to tell us any information that you think we should know that we haven't asked about.
I mean, you guys asked about most of the things that is like the concept of it. The hard part of what's happening is like it's actually a really simple model. And the idea of making it more complex is going against the idea that it's supposed to be a simple model. Um, and so I've had my own challenges kind of starting my clinic in this area, but there are other places who have kind of blown up exponentially because of where they're at and the interest in those spaces. But um, one of the great things about the membership based clinic is being able to offer services that another clinic isn't able to do, whether it's included in the membership or an additional charge. And I think those pieces, especially when we have so many things that the insurance doesn't cover when you're trying to access it, whether it's chiropractic work, acupuncture, injections, whatever, therapy, coaching, whatever it may be. But this membership based model is able to pull away from those restrictions and barriers and just offer people a service with transparency and quality overall. Um, I'm not there for a chunk of the stuff, but the flexibility and the differences of membership based clinics from city to city is really amazing, and just allows us to really kind of just take care of the patients the way that they want to be taken care of, but also offer services that they are interested in without having to worry if it's going to be covered by something because everyone's just going to pay kind of out of pocket instead of thinking if the insurance is going to cover everything when really they don't cover most things. So I talked about medications. I talked about labs. I do order imaging. Um, the things that I order most commonly are X-rays and ultrasounds. Because I am out of the network of insurances, expensive imaging like CTs or MRIs are things that I can't really order as an out-of-network person. But those are usually pre-procedure, pre-surgery kind of imaging that if I'm at that point in my workup, I'm already kind of referring them to someone else. I haven't had someone who was uninsured that needed those types of things or needed to go see a different specialist yet. But everything has a cash price. We're accustomed to everything going through insurance, but all services have a cash price if you ask them directly. And so that's the other space of the medical industry that I'm kind of functioning in, if it is needed, that any patient at any point can know the cash price of something and decide if that is what they want to do. And we can be flexible with where they go because they're able to kind of ask people how much it would cost. And if just like, you want to buy something at one place and it's $20 and at another place it's $30, you're like, okay, well, I'll probably get the $20 place as long as the quality's kind of there. So people are able to just not negotiate, but like um, go to different places and see what is the best option for them because of this kind of step out of the health industry or health insurance industry kind of space that I'm in. Yeah, that's most of the clinic. I do have like I'm a one person show, so I have like plans if I'm not able to do care, and if I just like unfortunately pass away type of thing. But I try not to think about those. But I do have to think of like a succession type of plan stuff.
Is there ever a situation where maybe you need to go on vacation for a week? Like, do you have a substitute doctor or something like that for that?
No, my thing is if I'm doing anything for less than 2 weeks, I'm just like virtually available for my patients. Or if I'm really trying to go off the grid, then I just give them a heads up long in advance that I won't be available for a couple weeks. The thing is because I'm not like an emergency doctor, like people can always go to urgent care, people can always go to emergency room. And so though that's my backup plan if I'm away and someone needs some like physical evaluation type of thing, but I'm able to do telephone and video appointments when I'm gone. Like tomorrow I'm going to DC. And so I told my patients that Monday, Tuesday, Wednesday, I'll be available for virtual, but I'll be gone. I'm gone for a week in March for a Costa Rica trip, but I'm still gonna have access to internet. So those short ones, I don't get coverage. For anything over a couple weeks, I have a doctor here who is willing to like cover like an on call. So like any urgent matters, medication refills, someone needs to be seen in person, like they can go to her office type of thing. Um, anything beyond, or if she's not available or anything beyond a couple weeks, there are services to get temporary doctors. We call them locums. And so you can pay them to do on call work. You can pay them to run your clinic in a general sense of like seeing people every single day as needed. And so those are my general plans. Now, if I'm not able to like initiate those, that's a different conversation. I do have a backup person who knows what to do, but I'm hoping to not have to be gone for an extended period of time. And there's also like the flexibility of knowing not everyone sees me on a monthly basis, so it's not even like if I'm gone, that 100% of my patients are going to all need appointments that month. And so, because I have a smaller panel than some of my counterparts, the stress of being gone for an extended period of time is not as like heavy because I know there are ways to cover my smaller panel, as well as ways if I am able to do virtual kind of care. Um, but so I have a 2 week, 1 month, and beyond plan. Um, if something were to happen. And if the patient is not liking kind of that plan or the lack of availability, then there's the option of just ending their membership and letting them go somewhere else and sending records over kind of as needed. But um, most of the people who are doing what I'm doing, anything over a couple weeks, they are really actually looking at other services, other people to actually cover. If you're in a place that has a membership based clinic also, then you can get like collaboration. Well, when I'm gone, you cover me. When you're gone, I'll cover you type of thing. Because I'm solo here, that's not as easy. Like there's places that are an hour away, but like my patient isn't going to go like an hour away to go see someone. That's so I would have to figure out how they can be seen like more locally, beyond the urgent care type setting. So, but if something like really, really bad happened where I wasn't able to take care for a long period of time, then it would be hiring someone to kind of cover until I am able to return, or allowing people to kind of end their memberships or pause their memberships. Like maybe it's not necessarily that I am taking care of everyone. Maybe I'm allowing people to like, hey, you know, I won't be here for March if you don't really want if I'm not able to get coverage and you don't want to pay for the March membership, then we can pause it, and then when I'm back I can ask you if you want to return type of thing. So there's different options. Um but for regular vacation stuff, I still just cover for I don't mean I haven't taken a 2 week vacation in a very long time. But first, yeah, standard vacation things I just cover myself. Let people know, and because people know I'm gone, they haven't actually asked for like, oh man, I really need to be seen in person. Most of it's, oh, she's gone. I'll just ask her when she comes back, type of thing. So, but I also
Okay.
have a very small pack compared to other people right now.
Yeah. Yeah. Well, thank you for telling us about your business a little bit more, and thank you for answering our questions. I think we're kind of good on our end for now.
Yep,
Yeah, thank you so much for your time.
Thank you, Dr. Harris.
you guys are welcome. If you have other questions, let me know. And we kind of go from there.
Cool.
Sounds
Okay,
good.
have a
You have a
great
great rest of
day.
your day.
Have a great day. Thank you.
Bye bye.
Thank you.
Bye.
Bye.
Bye.